Hi, welcome to Siskiyou Spotlight. My name is Deborah Brannon. I'm the Executive Director of the Siskiyou Media Council, and we produce this show periodically to highlight events and people and interesting opportunities in our county that you might not otherwise be aware of. So today we're going to focus on rural health training and also workforce development in general. I have three wonderful guests with me today. I have Jonathan Andrus, who is the CEO of Fairchild Medical Center, and I have Amber Clapp, who is an RN up at Fairchild Medical Center as well, and David DeLalana, who is a doctor up at Fairchild Medical Center. And I will ask them each to introduce themselves and just tell us a little bit, Jonathan, about just a little bit about your background and what you do up there. And
sure. I had the good fortune of moving to Siskiyou County about 10 years ago with my family, and I've been CEO at the hospital, Fairchild Medical Center, for the past several years. Prior to my advancement to the role of administrator, I was an assistant administrator. I have experience in larger corporations such as Catholic Healthcare West, and was trained through graduate school through a master's in healthcare administration program, originally from southern Utah.
big change of scene.
Yeah.
I've never seen southern Utah, by the way. I still have that on my list of
Beautiful
things to
country.
do. I know it is. I'm tired of seeing it in books. I want to go there. Amber.
I grew up in Siskiyou County, and I did all of my schooling here at COS, fortunately, and I work as an RN in the emergency department at Fairchild, which is a great experience.
You have a nice new emergency facility up there too, don't you?
Yes.
I remember when that was being built. Thank you. And we're going to hear more about your story in a while. Thanks. David.
Well, if you want a change of scenery, my wife and I relocated here in 2006 from Honolulu, Hawaii.
Yes, and you bring the islands right onto the set with you, okay.
I became a private family physician up in Yreka in October of 2006, and have worked at the hospital since relocating, and then became the chief of staff of Fairchild last year.
Very nice. Big job. And is that where you're from originally, Hawaii? You just said you...
No, I'm born in New York City, actually.
I'm a New Yorker as well. There you go. Okay, show's over. No. Jonathan, maybe you can tell us briefly, just give a very brief overview of Fairchild Hospital. It is different. It's not part of a larger consortium or foundation or whatever, such as Mercy Medical. Tell us just very briefly about that before we get into workforce development.
The Fairchild Medical Center is a provider of acute medical surgical services, both inpatient and outpatient. We characterize our standing as freestanding or not affiliated because unlike many of the smaller organizations across the country, we remain freestanding. We have a local board with full fiduciary authority to govern the organization. We also are private, nonprofit, and have served the residents of Siskiyou County for many, many years. We have a medical staff that is made up of primary care physicians, hospital-based physicians, and specialists also that have served very well for several decades. Specialties such as orthopedic surgery, general surgery, and others.
Okay, nice. And I've seen it. I remember, as I said, I remember when I was up at that newspaper, the Daily, when they were building the emergency room. So I recall that. You have a new facility now, too, across the street? Isn't something...
We are, in fact, the open house is this week, so it's been an exciting time for us. This is a project that has been 2.5 years in the making, and we are completing a significant expansion of our outpatient, one of our 3 outpatient clinics,
Nice.
Fairchild Medical Clinic. We also have a clinic in downtown Yreka, Siskiyou Family Healthcare, and a clinic in Etna, Scott Valley Rural Healthcare. But this is a pretty significant expansion for us across the street from the hospital at Fairchild Medical Clinic.
Very nice. Open house this week, huh?
Thursday night,
Thursday night.
Would love to invite all to join us.
Thank
so
you.
Thursday night, August 25th.
Okay.
We're really excited. It's been a major project, and I think we'll really serve the organization and the community well as we address some of the issues that we'll be talking about.
I was just going to say, what a perfect lead-in to the departure point for our conversation, which is workforce development in Siskiyou County. You and I have talked. We will talk about medical training in a moment and talk about our new Rural Health Sciences Institute and so on, and the ability that we have now to offer rural healthcare training to encourage people to stay here and work. But it's a bigger issue than that. I mean, you're talking about, now I'm realizing too, not just, we had talked about secretarial and IT people and groundskeepers, and also we're talking now about contractors, construction, I mean, just about everything.
In my view, workforce development is a key issue across many industries across the country. Certainly in healthcare, Siskiyou County, the service industry is a very important industry, and healthcare is probably the primary contributor within the service industry. And we are only as good as the staff that we have to provide the services. And so across every level of our organization, workforce development and training is a key priority and strategic issue for us.
And we talked earlier about the collaborative efforts that are made to bring COS and its programs forward, not only in medical training, but also, I mean, we have welding training and lighting, and heavens knows we have some television production training here as well. David, what's your sense? You've been here just not quite so long, and you see that we are about 45,000 people in 6,300 square miles. We have one small college. What do you see in terms of workforce development? What are some of the opportunities?
Well, it's very challenging. I mean, we are in constant, I think, from a medical staff standpoint, we are in constant recruitment for personnel and staff and services that we don't have or aren't able to provide locally, not because we don't have the infrastructure to provide them, but because we just don't have the workforce. We don't have the personnel to provide certain services. And it's very difficult to recruit and, you know, attract and retain people to this area to provide those services. So it's a challenge.
It is, and of course the hope is, from my point of view, the hope is that we can get some of the people like Amber who were born and raised here. We can provide sufficient training for them all across the board, and then provide the work. But at least, as you said, both have said, at least in the medical field, the work is definitely here.
There have been several studies actually that have shown, at least in the medical profession, that if you can actually train people locally from rural areas and raise them up through the professional ranks, that they have a much, much greater chance of staying locally and working and providing services within the rural communities.
Deborah, just to characterize this issue, to talk about the level of importance, it really is an extremely important issue for our organization. There are a couple of market forces that I think that are causing that. On the one hand, you have an aging population that are demanding more services than ever before. And so we have that challenge of having the capacity to accommodate that demand for services. On the other hand, when we look at our own workforce, those that are providing those services, we have an aging workforce. And across the country, and of course nursing is probably the largest sector of healthcare professionals. You have, you know, within the employed ranks of the hospital, of course, you have many tens of thousands of physician providers. But I think the number that I saw was 3 million nurses, licensed nurses across the country. 34% of those nurses are older than the age of 50 years and older.
Wow.
When we look at our own organization, Fairchild Medical Center, 54% of our nurses, compared to the national number, are older than the age of 50. And so for us, this to me signifies, and this goes across really, I could give several examples of departments that have a wonderful, experienced workforce, but we're going to be challenged as we move into the future to find replacements, again, within the hospital, clinical and non-clinical, but also with our physician providers and partners.
So what I think you're saying here is that we not only reflect that, the statistics here not only reflect, in terms of the nurses and aging, not only reflect the country, but it's exacerbated by the fact that our population is so much older. So our percentages are higher. This is what you're saying, 54% versus 34% over 50. Okay. Well, I'm over 50. And I'm still working. Who's going to take my place? I don't know. Yeah. Well, you know, let's. So specifically, the value to Fairchild provided by the Rural Health Sciences Institute, which is on the COS campus in Yreka. I know that right now there's a nursing program there. I believe I understand that there's actually more built into the building that is being utilized right now, so that there are ways to, for instance, offer down the line, offer X-ray technician training, because there's, I think, lead in the walls or whatever that you have to do. So how does RHSI impact Fairchild now in a positive way? I can't think of any negatives. And where do you see that going? And after we talk about this for a minute, I want to ask Amber to talk to us about her experience there.
Well, yeah, and Amber has a great story. Yes. I think there's no question in my mind that we enjoy a good partnership with the college, with the Rural Health Sciences Institute. 40% of the nurses at Fairchild Medical Center were trained through the program. Now think about that number, starting out as licensed vocational nurses, and then having the opportunity, many of them, to upgrade to a registered nurse, and then to even continue their education beyond their 2-year registered nursing degree, which is available. And as we've talked before, while the college has been a great partner in providing the classroom instruction and a location for the classroom instruction, we have been a clinical partner where students from the college have been able to come over to the hospital and receive a portion of their clinical training, and so that's been a benefit to them. And again, to the organization, when you have 40% of your nurses that have participated in this program, that's a tremendous benefit to the organization and ultimately to the community.
That's enormous. Yeah.
You were talking about some untapped potential for the for the facility. One of the biggest challenges for a rural physician is to get ongoing, continuing medical education. You know, that's a big requirement for the job and for your ongoing proficiency in medicine. And typically, as rural physicians, we need to travel to the big cities to get this.
Are these for what we know in other professions as CEUs?
Yeah, we call them CMEs in medicine. Just, you know, medicine's always got to have a different term for everything. But to get our CMEs, typically we would go to San Francisco, or I've gone to LA a few times, sometimes even clear across the country. The last time I recertified for ACLS, Advanced Cardiac Life Support Training, so for emergency resuscitation, I did it at the Rural Health Sciences Institute.
Oh my, wonderful.
And they have these wonderful mannequins,
yes.
And you know, I mean, it's just a tremendous facility. You know, imagine what else we could do from a CME standpoint in that facility for our local physicians. So.
Great point, thank you. Good story.